Ryan, it's nice to meet you today.
Good to meet you as well.
Well, tell us who is Ryan and who is PracticeFusion?
I am the founder and CEO of PracticeFusion. We are a free web-based electronic health record provider based out of San Francisco. We are the fastest and only true free way for physicians to adopt electronic health records. Largest physician-patient community in the country that's open. So the only communities that are larger than us are Kaiser and the VA system. We have about 40,000 users on the system, about almost 4 million patients.
When you say the VA, because I think we mentioned before we got the interview, I did an interview with some folks, and they talked about how the VA is sort of cutting the edge right now as far as electronic health records. And some of the things I've been seeing and reading about the fact that electronic health records are here to stay. So the whole concept behind it, where does your company come in, and what are you guys going to do when this comes about? I mean, as far as where do you go?
Sure, the VA is a great success model to look at. I think Kaiser is probably even more so cutting edge because there's a lot of patient engagement there. One way I look at our system, there's a lot of different ways to kind of approach it or explain it, but I think it's much like Kaiser's electronic health record system, but it's really open and for the masses. So Kaiser has a bunch of elements that are very, very successful. They have a lot of patients under one roof. The doctors are standardized, all using the same electronic health record. They can share patient data with other doctors real time with the system. Patients can access that data. It's because it's all in one master repository. It's all aggregate and controlled. We are the equivalent of that, but doctors don't have to spend hundreds of thousands of dollars for the system, and the implementation is just much faster than Kaiser's was. Kaiser's took 5 or 6 years. Ours takes a few days, if even. You can, as a physician, you can come in, sign up the same day, be up and running it. You can master the system within a couple of days. We take care of all the heavy lifting and connectivity. So in the space today, there's a lot of integration and standards, HL7, all this stuff. We do all that. So the doctor... Think about a good analogy is you have electricity, but you don't know where the power station is. You know what I mean? It's really the same thing. It's a managed service. It's web-based, so you have an internet connection. You can access it at home, in the office, hospital. But it's not just a piece of software you're using. The connectivity to 50,000 pharmacies, we take care of that for you. So the day you sign up, we validate you as a doctor. You have access to all those pharmacies. We've done it. Major labs, Quest, LabCorp, a personal health record. We give you the ability as a physician to share patient records with your patients real time, no integration. The doctor doesn't have to know technology, do anything. It's just part of this, again, web-based managed service.
Cool.